see the profile, and also for the sequential HD or IZQF. You can activate by pressing sequential. Yeah, choose the UF and choose the sequential. And the only thing here, just you have to set the amount, total of sequential therapy, and the time. Then it will be done. For the VF, like this flow, and also for each one, as we mentioned before, we have a file for each one. So this is for the conductivity profile, or solving profile. So you can start with a specific amount. It's the
increase.
I want to start with three and end by 13.4. So by using linear, it will start increasing gradually or exponentially. Okay?
Same principles are different.
Yeah.
Then what?
On this case. The same things for the bipolar conductivity, the existing picture and the existing picture. This is for the Hibari. So now, look, here we get
Shelf.
a warning message for surface brain bump fail.
Because it's open.
Okay? So what we have to do now, I will go here, you can see. Now the system, as soon as we get a yellow color wave,
It's not fast.
it's not fast, and the system tries to repeat it continuously. Look,
Yes, you
repeat,
can.
red, and again repeat. So
So,
the only thing you have to check now the headroom bump. Oh, I forget to close down this one. Now it will repeat it and fast. Now because we are still in the preparation, the system gives you as a warning. But in case we are the therapy, you will get
that's now.
stress.
I level regulation.
Okay. Now the last thing is have
Blood.
side test.
Yes.
See now because we have a new line, we don't have Okay, let's continue. So here again, this is for the headering. In case you want to use the headering now, this is the time now to sit after finish the preparation. Yeah, after the priming, you can connect the headering and set the headering blade, and this is for the headering bolus volume. And in case you want to get the bolus, the only thing just you have to do is headering bolus. If you don't want to use the headering, of course you can keep it like now without any numbers here, and you will not get any alarm once you start the therapy. Okay? And from here you can change the syringe type of therapy. So here we have 10 ml, 20, 30, even 20, 25 of This is for the single needle therapy, and as you know, we have single needle valve and single needle crossover. The single needle valve, we can use this kind of therapy just in case if we have an emergency case, we can use the same kit of HD. But for the single needle crossover, we have a special kit with a big chambers, and we can reach up to 90% of adequacy comparing with the double needle therapy. Okay? This is for the single needle crossover. For the HDF, now we activate our system as we select from starting as HD, double needle. So in case if you want to activate HF, hemofiltration or hemofiltration, you have to choose and activate from here. And of course, you need to connect the HDF line for the second fucking
Bump.
This is for the anemia. Really good take care. And the most important thing, as usual, you have to set the patient pre-dialysis weight from the beginning. Yeah. By the way, the system now is ready to connect our patient. Version complete. Okay. This is the target of T2 the patient weight. In terms of the hematocrit also, you will get a new curve for the hematocrit. For the automatic blood pressure monitoring, this is the lower and upper systolic blood pressure to set the range for the limits. And you can check the trends by pressing here. You will pick the trend, and for the list, you can choose from this. The biology exclusion, as mentioned before, so by this system, we can decrease the frequency of the hypotension by controlling the little blood volume or hematocrit. Okay, the blood pressure. Okay, so before getting any hypotension, the system start if we activate from here the fusion. Okay, the system start to tune with patient according to the blood pressure. The only thing just you have to set the systolic lower limit for this patient. So, for example, we have a patient. So as soon as we reach the systolic, let's say 100, the system start to get an hypertension. Okay. So I will sit here 100. So before reaching 100, the system, it will start reduce the UF according to the blood pressure situation, or the return blood volume, which is from the hematocrit sensor. As you know, when the system tries to get more of fluids from the patient, the blood will be very concentrated, and it will be an indicator to get a hypertension. So here we have the system can be able to manage this situation by two parameters, the blood pressure and the hematocrit, the resting blood volume. Okay? Also, we have an option of light. Light means we depend only on the blood pressure, and we ignore the left blood volume parameter. Okay? But in case you want to mix, you have to activate the fuse. If you don't want to use it, because sometimes we have patients who start the opposites of hypertension from the beginning of the therapy. This patient cannot be activate this option for this patient. Why? Because from the beginning we have a hypertension. So how the system can be able to remove any fluid? So this option, it can be active only in case if we have a hypertension risk during the therapy running. Will come, not from the beginning of the here, guys. Any questions? Okay. This is for the limits of the axial pressure, venous pressure, the BBE and the TMP. You can check the limits here and the care for each pressure. And the last one is for the Nexadia, which is IT department. We can also connect
patient cards.
our system to be integrated with your system and to transfer the data automatically to your station. Okay. Still we are working on, still it's not ready. The IT department is working with your IT department.
कंप्लीट वीडियो बनाना तो तुमसे सीखेंगे जो क्वेश्चन होगा तो तुमसे पूछूंगा
Okay, guys.
कंप्लीट हो गया
Any
क्वेश्चन नहीं करना
questions?
ना कोई भी नहीं क्वेश्चन पूछो बस
Okay, so
सारे क्वेश्चन मुझे पूछने पड़ेंगे बाद में
the thing is the most important point. The input here, this screen will be the most important screen which we react continuously during the therapy by changing the parameters. Okay, so you can reach again by pressing here or switch or by this on this parameter or this side. Okay? Questions?
And for the dialysis time, so it's like the minimum hours is 3 only,
Sorry?
the time for dialysis.
Yeah, as soon as you press here, you can
Therapy
change.
time.
Yeah, you can change. So
Here
this,
it's only
yeah, no, yeah. So you can change
you
it.
can either use that one
Yes.
or
This
manual.
one.
That one.
Yeah.
Or manual also can be with this
Or by
way.
this one.
Ayun.
Okay?
Ayun.
Yeah. Now, at any time you can stop the vibration from here. And by pressing here, again you will get a second confirmation message. Are you sure you want or this cancel? In case if your machine is ready and still patient not ready, you can press on the standby.
Standby bypass.
Yes, to save your solution consumption, dialysate consumption, make it zero. As soon as the patient, suppose the patient is delayed, and
Yeah.
now it's done,
Standby.
again you will
That
release
one is standby.
For how many hours
then-
this one can stay put on standby?
up to 2 hours.
Up to 2 hours. Okay, but it will not alarm you?
Sorry?
It will
You
not
will
alarm.
get here the timer.
Ayun.
Okay?
After that it will alarm.
Yeah. But it's better to re-switch every 30 minutes because you cannot keep the pumps inside stopped for a long time. Okay, to avoid any. Yes, that's clear, guys? Okay. Now, again, connect the patient, just you have to press. Now, this is for the level regulation to check or to set the levels in the for the venous and the arterial
Can
chamber.
increase the
But
pace.
we will recommend you please don't touch this one during the preparation.
Why?
Okay.
Why? What will happen?
Why? Because the level adjustment it will be done automatically by the system. If you touch during the self-test running means you will deactivate the automatic level regulation. And I cannot, sometimes during the self-test, this level it will be too low or too high
Yes.
according to the self-test which we are running.
Mm.
So please don't try to set the level regulation during the self-test running. Now after finish the self-test, now if you see this one it's too low, now you can increase or
Increase or
by pressing
decrease.
here.
Mm.
Okay, this is for the venous and this is for the arterial. Okay. Now I will connect patient here. Again, the system told me there is a missing treatment parameters.
You
The
can
UF volume. Just you have this here.
you can
to go
program.
to the UF volume. So the minimum should be set 200 ml. Okay? Now, I this connect the patient and this one. Okay, now I need. Do you have a needle?
Sorry. What do you need? Syringe?
Now, still we are in the connection phase. Here again you will get two icons. Okay? for the white connection and the red connection.
Connection.
Red connection means you will start to connect the arterial line
Arterial
and
only.
keep the venous connected here just to remove the whole of
Aywa.
fluids.
Yeah,
Okay.
aywa.
In case you have a hypertension, the regular one. For the white connection,
Yeah,
I will
together.
say the white connection means double connection.
Double connection.
Okay. I will disconnect both of lines and connect here. Okay, guys. So please, if you want to do the white connection, you have to choose it from here. Also, you have to change because if you change the venous and close, keep this one on the red, will give you alarm. This wall is closed. Okay. So you have to make sure. Red connection. I will take the arterial line and connect with our patient. Open. And start the blood pump. Now we will start putting the blood from the
Yes.
patient.
Venous pressure.
Blood detected. Or clumps.
Now suppose the blood it will reach here, you will get alarm to connect your patient. Okay, so you press here and this is the time disconnect and connect your patient. Start the blood pump. When you see this light, means now the blood pump is stopped.
I stop.
So you have to activate the blood pump.
Yeah.
Now you can
Increase
start increasing
250,
the blood flow. Now
300.
usually in case if we have a real patient, also the bypass it will release automatically.
Yeah.
And this is the time now to make the filter like this. Okay. And now because we don't have that blood, I will press on the bypass to start the flow.
Some clamp.
Naklan ng rubber.
It's blocking.
Now the film is running and you make it in time.
Lalong gumilid. Si Baba. Oo. Kita na niya kahit hindi may paharap.
We come on with 360 degrees.
The maximum blood flow, sir, 300 only.
Yeah.
The maximum blood flow.
No, we can
Can be 350 or 400. Then on your access.
Maybe 500, sir.
Pwede.
Sorry?
Pwede 500.
Sa amin ito.
Maximum.
Oo.
Dalang oras.
400. Yeah.
We can meet up
From
to
Juliet,
500.
extra also 500.
Hindi. Sa baba. August kasi agad yung dialysis.
Ah. Pero maganda, sir. Advantage yan.
Ganun po. Pwede nyo i-zero yung ano mo.
600.
Ay, yung
Try na.
600.
Ilagay na natin. Pwede gawin yung kanina.
350. For us, 350.
mga 13 sa Amerika.
Up to 250.
The green color, the pressure for TMP.
Okay.
Arterial venous TMP, the green.
So now
The artery is straight. Yeah.
you can check. You can for the hematocrit. You can see
Sabi ko
here
sila naglagay ng
HCD,
test.
Ah.
and also the
Ang
HCD.
galing sa
FB.
Okay.
We can see it right away
Yeah.
after we start.
After 10 minutes. Okay. Or by going to the service, go to the prints, and also
pinag-wala size mo sa start
we
sa
have a
babay mo
lot
sa
of parameters, so you can check
Pero hindi pa daw maganda.
Ay, sige, okay lang.
the hematocrit,
Pwede i-try lang muna sa isa dalawa.
and on this one you can see the HB.
Pero doon na, di ba? Sa kabila. Naging
By
magunaan
here.
eh. Sabay-sabay lang mo sunod.
Planning means na basta nila ng vacancy.
Ganit.
Planning.
Alin na buhagan si Akmel Abdullah.
Mabasa din sa
Okay, so we get by number,
You can see the, you can
by
read
the
this.
to see also the change during the therapy. Okay, even
Some words.
also you can check up to last 20 therapies before by pressing on the day, all turns, then you will get all the whole therapies here. You can check, choose, and program and check whatever you want. So here we have more than 40 parameters you can check. In terms of blood flow, the different pressure alarms, PPE, even the temperature, the anesthetic flow, the HOF, everything you can check it by, choose whatever you want. Here, in this area, you can see the arterial, the venous, and the TMP pressure parameters.
There are But can we really rely on the hemoglobin? Sa ano naman kaya? Sa naman kaya sa
It will be, yani, it's not accurate. You can reach up to 90% accuracy. The most important here, because you know, it's once we have a substitution fluid, especially with the HOF, or if you give some of arterial bolus, also it will be affected. Okay. The most important thing here, the system, it will help us to follow the changes, even the accuracy. If it's not accurate 100%, suppose we'll start with 10, and it will be, suppose after 10 minutes, 15 minutes, we will get a systemic lot, and again we will reconnect the system. It will show you the change between the last one and the current one. So even if the system it will not give you as an accurate parameter, you in case if you have any hypertension or having, by pressing here we get here out of icons, which is organized here. So you can
Bolus
get
and
any bolus here. Just you have to set the amount 159 daily plus by pressing OK. Now I have to remove this one from here. By pressing fluid bolus. Now the blood pump will stop to give you a chance to open the IV set. Yes, with this clamp. After open, you can press here, and now the system will start to give
100.
bolus up to 100. And no need to close any clamp because you can see this one now it's closed already. Once it's finished,
Yes.
Again,
after
I
finish.
just okay and start the blood pump. I just start
Then
again.
again.
It will pump.
It's not
Oh,
correct.
you need to unclamp there first.
Wait naman.
So no need to close any clamp manually. Also, you can press minimum blood flow, and by pressing the minimum blood flow, this one, it will decrease automatically
50,
to 100
100.
blood flow.
Mm.
And also you can measure the blood pressure by pressing here.
Ayun.
Yes, pressure or limit before you decrease the blood flow.
Increase the blood.
Now I will release the vessels.
How about minimum UF, sir? Where is that, sir?
The minimum
Yeah.
here.
Ah, there.
Menu.
Ah,
Yeah.
What did you put?
The same thing in case if you want to change the bicep
Change the backup.
or do therapy pose. In case the patient wants to go to the bathroom.
Bathroom.
You can choose
bypass.
this one. Therapy pose. Yeah.
Post-therapy.
Yeah.
Hindi na yung post-therapy. Post-therapy.
How long this one is if you post the therapy?
It's the, you have to, for sure, you have to return back the blood to the patient. Okay, to keep always the patient safe way. And it's depend from patient to patient, from case to case, it will be different system. Because sometimes when we have the clotting factor will be very high, or the hematocrit, the HB, so you cannot keep the disconnection times too long. And the most important thing, as soon as you disconnect the patient totally, make sure the blood flow it will reach up to 300, 400. Because if you keep it too slow, you will get the system fault. Because still we need, we have a blood compartment inside, that's why. So from case to case will be different. Okay? And again, to go back to the therapy, I press here after connection the patient and press control to go back to the By pressing on the protocol, it will be the same of info setting. So if you press here or press on the protocol, it will be the same to check all the patient parameters, which is happening during the therapy in terms of TMP, the heparin stop time, the heparin volume, the total substitution volume, the UF volume, the UF, everything it will be mentioned here. Then this is for the protocol, the edema, the hematocrit, also the history, and also here like the history, and this is for the therapy, which is the current therapy, which is Braun IQ. Any question, guys? Before determination.
What if we experience clot, sir? During
Changing lines.
clot
Yeah.
and already had a
Yeah, changing the line during the
Yes.
treatment.
Here for the changing the line, we have the regular one, which is the only thing just to remove the line and put it during the therapy running
Yeah, the
yeah.
way we're doing the old one.
with the old one.
Yeah.
But make sure it will be done in safe way. For this system, yes, suppose you have a clock, even the same thing can be run, the same thing. But here, the big Braun, to make sure it will run under safe, just to make sure even the changing it will be safe. Here also it will give me another option. to make it in safe way. As we mentioned before, here we have the setup screen. In the setup screen, you can choose the setting, and here we have the user setup. So by pressing here with a special code, you can change some of special parameters by the super user. Okay? So here for the disinfection, suppose I have a system clock and I want to change the lines in safe way. So if I stop the therapy, okay, I need some the machine, it will force me to go after finish the therapy to go to disinfection. It's too long time. We cannot convince the patient to wait until the machine do disinfection. So what we can do here, we can go here to the disinfection parameter and deactivate disinfection after each therapy. By pressing here and you save. Now, as soon as you finish the therapy, by returning the blood to the patient, you get, if it's possible, to return some of blood to the patient, and finish the therapy. By finishing the therapy now, the machine, we can
Automatically.
escape the disinfection, and the only thing, just we will need 10 minutes to repeat the self-test. In this way, the Braun guarantee this line is changed with the safe way. Why? Because as soon as during the therapy running, suppose you have a systemic clot, the TMB sometimes it will reach up to 400,
400 same.
and even the venous pressure also reach 400, 500. Okay. Now, as soon as you disconnect this transducer and keep you in the same therapy, here there is something happen during the therapy which is not clear for the system. The system cannot recognize what will happen. The only thing, we will stop the therapy and just remove this one. Once we disconnect this one, all the positive pressure it will remove, and you will connect a new line, and you will continue with the too low venous. So how the system it will recognize these changes? We reach up to 400, and after 10 minutes now we run with 150. So it's better, guys, to keep it in a safe way, to avoid any undesired alarms happens, which is not clear for the system. By go again to the disinfection, make it deactivated after each therapy. Okay, remove the whole after return back all the whole blood. You can stop, and you can escape. In this way you can escape the disinfection. But the most important thing, the same nurse who change this parameter, it should be come again and come here and again activate the disinfectant after each therapy. After changing the lines, it should be activated. Clear?
So every nurse has code password for that.
Actually, the super user nurse, because we don't want to give this passcode for all nurses. May someone who don't have a good experience to change some of.
Be given only the access to our supervisor.
Yes.
Because we have patients who are very cluttered.
Yes.
Usually,
Oh,
Yes.
during 4 hours therapy, we will change.
Even with heparin.
Yes.
Suddenly,
even with heparin.
Yes.
suddenly venous chamber is high, we cannot return.
So, why you have this dilemma? Why you have high risk for clotting with your patient? Did you check the hematocrit, the HP?
Coagulation.
maybe yes, we need to reassess the anticoagulation volume.
Since
And
he
dose.
started, sir, it's like
Hindi, sakto lang.
Since started,
dialysis. So, sama ba to?
the first hour you mean?
Mm.
Wallah.
Even from initiation of dialysis.
Oops.
Yeah, during dialysis we flush maybe 2 or 3 times
So,
with
in
normal
this way,
saline.
it's better to start shift or start convince your doctor to shift them to the HDF pre-dilution. Because in the pre-dilution, you have this option, sister, so it's better to use it with your patient, which may also, it will save your consumables.
Yeah.
In the pre-dilution, you will start to provide this substitution before start filling the filter with the blood. So we will do a continuous flushing for the filter to reduce the risk of clotting. So it's better to use the HDF type dilution with this type of patient.
Ganun din yan sa CBHDS.
So the only thing just
Before
we need
may
to
nagbibigay
use
ng
this where is it?
sanay. Dialysis. Para hindi
Yeah.
FD4.
Yeah, that's one.
This is the only
Pay
thing.
the pay.
The substitution
Pay
line
the
should be
pay.
limited. And you have only the water
Yeah.
source, so
Pre
you
tsaka
can
po.
use it.
Meron
You have this
nagbibigay
option.
siya ng masusupply.
During.
During, para hindi siya.
If you have a high percentage of clot, that's it. Okay? Any question, guys?
Hindi mo.
So regarding to
May
that, you
nakalagay
can
pre-dilution.
do post
1,000.
process of the most safe one, which is as I show you. You have to be
But the program will not be reset.
sorry.
The program will not be reset if we will go back and we will disable the disinfection.
No,
Because we
you
will
have,
prime again,
Yeah.
right?
yeah. After finish the second deployment, you have to.
Again programming.
You
Reset
mean
the
the
program.
parameters?
Yes.
Yes, you have to take a note. Yes, because it's a new thought.
So it's like a new therapy.
Yeah.
New therapy.
This is one of disadvantages of this.
Yeah, this machine. Not like you can continue.
It's a total reset.
Even
It's
you
a
can
total
continue.
reset.
Even you can continue, but as soon as you remove this one, you will get done here, but also you have to do it manually.
Not like.
Even here, you can do it. But for the priming, you have
So
to do
another
it by
reset,
the
like for example,
normal saline.
in the middle of the day, 4 hours. And
Yeah,
then
2
finish
hours
2
finish.
hours.
2 hours
So we will program again in the parameter in the machine 2 hours more on
Yes.
this.
That could be.
It will continue.
Reset.
Yeah, it will be considered as a new therapy. But
As a new
New therapy.
if you don't want, you can continue like what you do with the daily plus. The only thing you will keep it, but now the machine cannot recognize if it's done in safe way or not.
Ah.
Even in the daily plus. It will be not clear for the system what will happen. We reach 400 and now the blood, the venous
But
pressure is
still we can
150.
do.
Yeah, still you can do it. Even with this machine. Okay? Any question? Any question, guys? Before termination? Okay, for termination it will be the same like the plus. The only thing that we have to press end of therapy from here. Are you sure? Yes, I'll press confirm. And this is the time now to disconnect the arterial. Yes, computation. And now, as mentioned before, we can use our substitution fluid to retain back the blood to the patient, because now here we have a sterile and clean fluids, which is a substitution, but here we have a problem with
Kasi
as soon as we disconnect the line from the patient, still we have a blood here in the blood.
Yes.
So this is a sterile area. We cannot connect here directly, and that's why you have to use so-called restitution connector. This one.
Connector.
In the second.
Yes. So please make sure you will not lose it. Throw it. Okay.
Connect for
This one it
termination.
should be connected here. Connect here. Okay. And now you can start the blood.
Can you press the blood pump?
Yeah, sure. Because I don't want to.
Wala. Nakalak yung alternate.
Iman.
Nutrition.
Ah, okay.
Wait, what's the problem? The blood is still there. I mean, what's the problem with the
Single.
Transmission now. Okay.
Hmm.
Why machine is
the configuration. So usually it should be connected here, okay, and you have to wait until the normal saline or the fluid reach here, and this is the time now to disconnect. Maybe I have to check the system configuration of this one. Okay, and that's it. After that, now this is the time now it will be coming. Up to 320 or within 5 minutes. Who will reach first, the system will stop automatically the blood pump. Okay?
But we can increase it.
Yes, increase or decrease. You can stop or retain more by pressing.
थक गया यार, पूरा वीडियो बनाते 2 घंटे हुआ।
पूरी बना दी है, मैंने ये वीडियो देख के मैंने सीखना है, मुझे तो मैंने क्लास
Now you can
Termination तो समझ में नहीं आया।
the laser. Yeah. Okay. Now this one
There's another
come
connector maybe.
with the HDF kit. Now for the HD kit, this one it will be open.
Yeah.
Open.
This one it's only covered because why? Because if we are using the HDF line, the only thing just we have to clean it from this. We can connect the arterial line here. Okay? But for HD, this one it will be open, and this is the difference also both between the
कहाँ गया वो
distribution
connector?
connector and the cover.
उसके हाथ में है। नहीं दूसरा कनेक्टर है।
Yeah, it will be different. This one is closed, and the other one it will be open.
तो ऐसे कैसे होगा?
Okay, guys. Now we will drain the dialyzer and drain for the filter. So for the draining of the dialyzer, no need to keep the dialyzer inlet with the dialyzer. You have to keep this one. Make sure there is air coming inside to drain all the fluids. Now you can detain.
Yeah. Come I'm sorry.
Now, and this one, it's already drained. I will remove it. Close. You can put it slide with any connected line. The one speed.
मेरे समझ में आ रही है
Unload the machine. Yes. You have to push back. Now you click it. Yes. Four. So we have to remove this thing.
Okay, 6.
Ma'am, if we can finish for tomorrow, no need
Or
for
every
Friday.
tomorrow, yeah.
Yeah, tomorrow.
Tomorrow na lang after.
Last week tomorrow.
Or first, if after finish the patient, for example, empty here, we
Wala
can
na
do
lang
that.
over there. Ah, yeah.
Wala nang pamit. Pero pwede pa yun, sir.
They will
Yeah.
Yan lang yun, Sir Rahim.
Yeah, it's good.